We're very excited to have the scalp cooling technology at Rush. We started it towards the end of 2018 after a study came out showing that a significant number of patients were able to keep the majority of their hair while using scalp cooling during their chemotherapy. Right now we're using it for our breast cancer patients here at Rush. There's certain chemotherapy regimens that it's more successful with than with others, even in the setting of breast cancer.
I was diagnosed in May of 2018 through a routine mammogram with breast cancer. After my surgery, my doctors told me that I would need chemotherapy because my breast cancer had been found in one lymph node. And so I went through chemotherapy in the fall of 2018.
Maureen was my first patient who came to me after we had the ability to offer scalp cooling. The regimen for chemotherapy that I was prescribing for her was one that had the highest success rates with using the scalp cooling. A nurse will fit it to make sure they have the right size before they even start. And prior to the infusion of chemotherapy, during chemotherapy, and for some time after the infusion of chemotherapy, that cap is hooked up to a refrigeration unit. So their scalp is essentially being cooled the entire time that they're getting chemo and for some time before and after.
I would arrive early and wear the cooling cap half an hour before my treatment started, and I would wear it for a full 1.5 hours after my treatment ended. And I did that through every cycle of chemotherapy.
The reason that we think it keeps the hair from falling out is that it causes the blood vessels on the scalp to constrict from cold, and so the chemotherapy agents may not get right up to the scalp, allowing them to keep their hair. As with most patients, when I tell them the side effects of chemotherapy, the one that makes them the most upset is about losing the hair. I think a lot of that is because then everywhere they go, everybody they see knows that something's going on with them.
The results were very beneficial for me. The cooling cap company says they cannot guarantee anything for a patient. However, my results were wonderful for me personally to be able to look in the mirror and see myself as I had always seen myself to some degree was really beneficial and was a very positive thing for me. I have gone through surgery, chemotherapy, and radiation, and I have a final surgery this summer. I have been told by my doctors that I'm cancer-free, and that's a really good feeling.